So we conducted a trial of exercise training for people in their local communities who live with muscle and nerve disease. So this was a feasibility study that was funded by the National Institute for Health Research, Research for Patient Benefit grant. We took two groups of people, one group with a muscle disease called inclusion body myositis and another group with a disease called Charcot-Marie tooth disease that affects the peripheral nerves. And we wanted to see if people exercising in their local gyms with support from the trainers and from us as a research team would help them to increase their fitness levels. We've got a paper on this coming out, and we wanted to give an explanation to you, and if you want to see the paper, the link will be below. So we wanted to do a design where everybody who was in the trial did both the training and the control. We did something called a crossover design. So people in one group would start with the training, have a break in between to detrain, and then have a period where they did nothing. And the second group started with doing their normal activity levels, and then they would do the training at the end. And that way we could compare the effect of the training with the effect of people not doing any specific particular exercise above what they would normally do. And in the group of people with IBM, the muscle condition, we had 19 people start the study, and in the group of people with CMT, we had 26 people start the study.
Hi, my name is Magda. I'm a research physiotherapist, and I was involved in the study during measurement sessions throughout the study, which took place at the Trials Gym at the MRC Centre in London. That involved 4 sessions where we would invite people to come into the Trials Gym, and I would be involved in an exercise test which was taking part on the bike that you can see here. But the main point was to push people to their maximum, to do a maximal exercise test, which involved a test called the VO2 max. It was a short test, but it really pushed people to their maximum to look at their fitness levels. How do you feel on this scale?
2.
So I was involved in the measurement sessions of people with inclusion body myositis when they're coming here to our center, and also I was supervising people with CMT during their training in their local gyms. So they were supervised throughout the 12 weeks of training by the personal trainers, and I would come visit them twice to check on their training progress in the gym, and also I was in telephone contact with them throughout the period of the study to motivate them and again just check on their progress and how they were doing in the gyms. So we asked people to exercise 3 times in a week for up to 30 minutes in their local gyms, and every 4 weeks we would make the program a little bit more difficult as they were improving. We also gave them a heart rate monitor, polar heart rate monitor that they were wearing, so we can record all the sessions and check how much they were able to do.
So the results of this study were really encouraging, and we found that those 12 weeks of exercise bike training made a difference to our patients. So of the 23 people with Charcot-Marie tooth disease, they showed that there was a 12% improvement in their fitness levels when they did the training. When they weren't doing the training during that control period, they actually showed a slight drop. In the inclusion body myositis group, the IBM group, they showed a really big improvement of 17%, and that came out as being quite a significant increase when we looked at the numbers. So this is actually what we call a feasibility study and a pilot study. So is it feasible for us to deliver this sort of training in people's local communities? Now, we interviewed people, and the participants in this study found that the support they had from the trainers and from the physio visits were actually really important for motivating them to continue with this. So we think that if people have the support in their community, then they can achieve increases in their aerobic capacity and their fitness levels, as we've shown with this. This is a small study, but we think that if this was scaled up, with the support actually provided, it would be very useful for us to know if people can get lifelong changes in their fitness levels. But the support is really important, and that's what came through very strongly in our interviews. So we're now looking at a piece of work with some collaborators across the UK to see how best do we support people to exercise and to be physically active in the community.